welcome again to Ars Medical VNEW podcast here this afternoon in beautiful Fort Lauderdale, Florida. In studio, we've got a special guest, Dr. Red Alinsod. Dr. Alinsod, welcome to the program.
Thanks for having me. It's a pleasure to be here.
So you've made the trip. You're currently working out of two locations. You've got your practice that you've had for years and years in Laguna Beach, and you are now hanging your hat in beautiful Dallas, Texas. So, where'd you fly in from today?
Today, actually, I flew in yesterday from Dallas.
From Dallas.
Yeah.
Okay, wonderful. And so you've got your practice that's getting up and running there. Tell us a little bit about what you're currently focusing on with helping these young ladies now in Dallas, which puts you in the
Yeah.
center of the United States. And of course, you've still got your practice in the West Coast and Laguna Beach.
Yeah. I'm a urogynecologist, and mostly my practice in the past almost two decades has been on cosmetic gynecology, where I mixed both function and appearance together, so that I'm able to make things work, function well, get rid of symptoms, but also make it beautiful. So that's the whole practice I've had. I've been teaching that around the world for the past couple decades, and now I've moving from my Orange County practice in California, which Dr. Judy Way, a fantastic surgeon, will be taking over, and I'll be moving out to Dallas where my family is. And
Okay.
so that's why I'm going over there. You
So
got to
you
follow your kids.
follow the kids, and certainly the women of Texas will certainly appreciate it. I know you have a big following. You have a lot of women that travel to come see you. Um, well,
If
we spend all this money, right? Face, Botox, breast augmentation, and many times, this is like the last place that gets thought about.
Yeah, I'm
And
always the last one they think about. The
but the most important, truly the most important, just because to your point, it's a confidence booster. Uh, these ladies can feel, call it sexy again, and you're certainly going to restore these women back to the, we call it the original manufacturer of how it was truly designed to be in the first place. From a, if you really think about, you know, what would be a timeline of if you're going in and you have some prolapse repair or stress urinary incontinence, what can I expect to be out of commission?
Well, these surgeries can sometimes take a long time when you're combining this. We call it makeover down under.
Right.
All right. So, for example, a labiaplasty will take a couple hours. If you're doing minora majora, it may take 3 hours, and then you're fixing it the inside of the vaginal canal. It's also a couple hours.
Hmm.
So it's a full reconstruction. It's just like a face or tummy. It'll be 4 hours,
Okay.
right?
Yep.
And then the recovery from this is 6 weeks.
6 weeks.
Weeks of healing. But my patients, I do most of these awake in office, except when I'm doing a big bladder repair. I'll take them to the surgery center.
Okay.
But awake in office, no IV. They're talking to me. We figured out how to get them comfortable.
Right.
It's wonderful. And so they walk out of my office, and we'll see them in 2 weeks, make sure they're doing well. And then at 6 weeks, they're pretty darn normal.
Right.
We tell them not to have sex yet, so we tell them at 6 weeks they need to do some massage work on the surgical areas, so
Okay.
to reduce the scarring.
Hmm.
And by 8 weeks they can be sexually active.
Okay.
Yeah.
No, that's great, especially from the standpoint that you can take care of these ladies right there in your office. And I think so many people have a misconception where they would say, "Hey, I'm putting this off because I don't, want to either A, be out of commission, when in fact it goes fairly quick, right? The road to
Yeah,
recovery."
they're actually walking the same day.
Right.
In a week or two, they can start driving. It doesn't really mess up your time of feeling normal, doing normal things more than 2 3 weeks.
Okay.
By then, you're doing all the stuff. In fact, we have to hold people down and tell them not to do too much,
Right.
because that's when things rip, tear,
Right.
if they try things too early. And then this is also the time in life a lot of these patients are around the time menopause or in menopause. This is when we encourage them to consider the hormone therapies to keep their tissues youthful, young, producing normal moisture. So this is a wonderful time to discuss all these things with these patients.
You brought up a great topic, hormone therapy. What's your where do you start with a patient when they come in to see you?
Well, usually I will have a whole list of questions. I have maybe a one-page question, so I know exactly what they're complaining about. For example, do you get hot flashes, sweats, chills? Are you kicking your feet out of the sheets at night? Are you leaving the windows open? Are you waking up frequently? Do you have vaginal dryness? Does it hurt to have intercourse?
Hmm.
Right?
Yep.
And these are common things we ask about. Those are the most common symptoms. But there are other things like um, uh, the face getting saggier,
Okay.
skin's getting thinner,
Hmm.
vaginal tissues are also getting thinner and sagging more. They kind of all go together. And this is also the time I tell my patients this is when your risk for heart attack, strokes, colon cancer, all these things start going up, because as you age, those things go up, especially when you go into menopause and you lose the protective effects of estrogen and progesterone.
Right.
So these risks go up. And once I point this out to the patients, we want to get them back to their feel good levels.
Yep.
And so that's what I encourage. And it's not the risky thing that it was years ago. And remember, you have a lot of those articles that said your heart attack risk, stroke risk, all those things went up.
Cancer.
Yeah, cancer. That was
Right.
with the old Prima and Provera synthetic hormones. Part of it was synthetic. And now with the bioidenticals, such as natural estrogen, natural progesterone, natural testosterone, those risks really do not go up. And in fact, the risks for heart attack and strokes and colon cancer, especially
Right.
colon cancer,
Right.
50% reduction.
Right.
So unless you've had a heart attack,
Hmm.
breast cancer, or uterine cancer, or a stroke, you're probably exceptionally safe to be on it.
Yeah. No. I mean, listen. That's great advice. I think it's something that women should definitely consider and have that conversation with their gynecologist or someone especially trained in the space of hormone replacement. Just because you're going to feel better and you're going to reduce those risk factors that you pointed out, and don't delay it, right? Because
Right,
it's
don't
the
delay it.
longer you delay it, the all of these things start happening to your body, and so we want to just try to do an easy transition and not have to go through all those symptoms that you talked about, Dr. Alinsod, with regards to at night and the sheets and the sweats and the skin and all those things.
And the important one is the plummeting desire.
Yes, exactly.
Huge.
Huge, right? So we want to keep all those things on the positive side. And so, any other things that you would love to share with these
Yes,
ladies
yes, yes.
that are gonna be viewing this
Can I
either
do
either
a
live or
Can I do a shameful plug?
you can absolutely do a shameful plug. Yes, you
All
can.
right. So Rob's has developed this VNEW dermal allograft product for fixing fallen bladders, fallen rectums, and it's this shaped biologic dermal product, and it's perfectly shaped to fit in the pelvis, and it makes life so much easier for us surgeons. And the shameful plug is I designed this almost 20 years ago, and now it went away when all the mesh thing came into
Right.
the market. Now he's made into a dermal product of that perfect shape, available to surgeons worldwide. And it's a shameful plug because I think the design is the best one there.
There you go. There you go. Hey, we'll take it, and we love the collaboration, and it's important to be able to have people like Dr. Elmsod to be able to work with on a weekly basis. So we feel very fortunate and certainly love to have him in the studio. We'd love to have you back. Congratulations on the move.
Thank you.
Super exciting to have you even closer, not as long a flight, even though I certainly love your office location in Laguna Beach. Um, Even better when you're in the middle a little bit.
Only
You
two
know,
hours away, right?
only 2 hours away. It's a quick flight, and I think that the ladies in Texas are going to be very fortunate to have someone
Thank
with
you.
your skill set. And I know that they're all about health and wellness and looking good and feeling good, and you kind of bring all those things together. So
Yes.
we, we appreciate that.
Well, Rob, for your audience, I want to just notify you that for information, I have this website called gynflix.com, Gynflix. Initially just for doctors, all the top surgical videos on how to do things. But this year, for our audience here of ladies, we're going to add the second piece. We're going to abbreviate and make short snippets of all those surgical videos so you can see what these things are that you're considering. You can see what a fallen bladder repair is,
Right.
rectal repair. We're going to have it there for you. So the audience here of women, probably within a couple months, we will have Gynflix for women.
I love
So
that.
you
I
can
love
see, you can educate yourself before you go see your doctor, or they recommend something. Now you know what they're doing.
that. Right. And as the ladies know, we feature the best surgeons from around the world to give you relevant information. Information that is up to date with the latest technology, and the fact that you can just come to this site and certainly go to Dr. Alinsod's site when you're talking about surgery or you're talking about information on your health and wellness for your pelvic floor. You can always check out the VNEW Health website. So I love the fact that you're doing that because there's so much misinformation, or it just takes a very, very, very long time to be able to find what you are looking for as a patient. And so if they can go to one site for their surgery videos, I know you curate amazing things from a physician standpoint. So I know you're gonna make it fantastic for the ladies, and they're gonna understand what they're gonna be going in to do. So congratulations,
Thank you.
and look forward to checking that out soon here.
Great to talk to you, Rob.
All right, thank you.